tal amigos de Forbes México? Nos da mucho gusto saludarlos desde nuestra plataforma digital Forbes Conecta para darles la más cordial bienvenida a nuestro Foro Salud, un sector en recuperación, en el que protagonistas de esta industria compartirán sus opiniones y experiencias para establecer las estrategias a seguir en un mundo que no volverá a ser el mismo. Agradecemos a nuestros socios comerciales Novartis, Siemens, Gilead, Cleveland Clinic, Hospital Baylor St. Luke's, Shaw Wellness Clinic y California Raisins. Antes de iniciar nuestro evento, vamos a escuchar unas palabras de Marco Landucci, presidente de Forbes México y Centroamérica. Adelante, Marco.
Buen día, amigos de Forbes México. Sean bienvenidos a una edición más del Foro Forbes de Salud. La pandemia dejó al descubierto fallas estructurales en los sistemas de salud de todo el mundo y México no fue la excepción. Pero la coyuntura también mostró enormes posibilidades para cambios profundos en las estructuras de servicios médicos, modernización y transformación tecnológica de los servicios. Y es que en la nueva normalidad no solo hay que cubrir emergentes necesidades en materia de medicamentos y tratamientos, sino avanzar en la investigación y desarrollo de curas para las enfermedades cronodegenerativas que estaban antes de la pandemia y que seguirán presentes a lo largo del tiempo. En Forbes México queremos ayudar a todos los participantes del sector de la mano de ponentes de primer nivel, identificando las directrices para alcanzar un sector que goce de la mejor salud. Así que quédense con nosotros a lo largo de esta jornada que permite ser muy interesante. Sean todos ustedes bienvenidos a esta cuarta edición del Foro Forbes de Salud México y esperemos que sea muy constructivo para todos nosotros. Muchas gracias.
Muchas gracias por tus palabras, Marco. Ahora vamos a dar paso a nuestra primera Forbes Talk del día con Francesca Colombo, jefa de la División de Salud, Dirección de Empleo, Trabajo y Asuntos Sociales de la OCDE, quien nos dará una visión sobre el panorama del sector salud en México. Adelante, Francesca.
Hi, I'm Francesca Colombo. I'm the head of the health division at OECD in Paris, France.
The pandemic seems to have caught many countries, including Mexico, by surprise. Were countries prepared to handle a crisis of this proportion?
Well, the very short answer is that no. I mean, most of the countries were clearly not prepared. They were really, without doubt, unprepared to face a crisis of this scale and impact. And this is true about countries like Mexico, but it's true also countries which had very high performing health system and countries with a lot of resources. So it's quite striking that up to now we have seen so many people who have lost their life. We're now nearly about 3.5 million people that lost their life to the pandemic, and many of those were also health professionals that have dedicated themselves to try to protect the lives of others. And clearly, we'll need to look back to address some those issues of unpreparedness, which we have seen in Mexico, but that we have seen in many, many countries, starting, for example, by investing much more upstreams in health systems, in better mechanism to ring the alarm bell when there is a possible pandemic or when there is a possibly health emergency, with having improved surveillance systems, improved the investments in prevention to make sure that we have more resilient populations that can be better prepared to face a health shock. Investment in the health workforce, that we are lacking a large number across the globe. There are some estimated 18 million health workers, global shortage across all countries. But even in things like data systems, ability to have much more real-time data that can support a moment of crisis, and having strong R&D systems for facilitating the global innovations ecosystem as well. And this is really preparedness, but we then clearly need also to make sure that when we have an emergency, there is a response by countries which is rapid. So the ability really to deploy speed and scale in managing the response is quite fundamental. So things like making sure that we can have enough personal protective equipment, that the supply chains are strong, diversified, and flexible, that the human resources can be mobilized, that we change the way health services are delivered to ensure we can surge capacity where the needs are the highest. So there is an entire really rethinking of the way we address a possible health crisis. And it's not just really for Mexico, it's really a matter of nearly all countries having to be much better prepared for the future.
So do you think there are some lessons about it? What are those lessons for the governments and for society all around the world?
Yeah, as I mentioned, I think the very first lesson is really need to invest upfront. Really, these upstream investments in health systems. To look, for example, at issues like prevention. The majority of the people who have been badly hit by the pandemic, whether it's in Mexico or in other countries, are people who are more vulnerable, either because of old age, but also especially because of multiple chronic conditions, or even factors such as poverty, which make their ability to manage a health shock much more difficult. So I think there is that idea of investing upfront in making sure that creates the population for having healthier populations and populations which are more resistant. If we look even at the case of Mexico, for example, there are some important risk factors that we have in OECD highlighted for many years, such as the rate of obesity of the populations, which are particularly high, and other risk factors like linked to diabetes, for example. It's quite clear that people who are poor or who are pre-existing conditions are more vulnerable to a health shock like COVID-19. There then clearly an issue of being able to respond rapidly and to scale, mobilizing resources, mobilizing the health workforce, being able to surge capacity. And that requires obviously having a health system that can very quickly adapt to a situation of crisis.
What are the main challenges?
Well, I think the main challenge would be really to address both the old and the new challenges. And that context will create a combination of double challenge to address. So the Mexican health system had some pre-existing weaknesses, which had been in the system for quite a long time, linked to the fragmentation, for example, linked to high level of out-of-pocket spending and poor social protections for individuals, linked to also factors which are outside the health sector, like level of inequalities, which are high into the system, the informality of the labor market that makes it more difficult for people who are in the informal sector to receive the protection that they need in times of crisis. So there are pre-existing conditions, even the resources being below the OECD average. If we talk about, for example, the availability of physicians or nurses, the health workforce that is so needed in times of crisis, but also the level of spending. Obviously, Mexico is positioning well below the OECD average. So those were factors that pre-existed. But there is then the new reality of having seen how unprepared countries are to a major health shock that requires ability to surge capacity very quickly, ability to respond rapidly, but also having invested upfront in some of the critical issues. And I think Mexico has been really, in a way, caught by the pandemic right in the middle of the process of reorganization of the health system, which was intended to address some of the pre-existing weaknesses, but clearly has even double caught Mexico by surprise by having to face with these double challenges. And this means that Mexico will have a huge job to do, both to in the immediate future to build the pandemic under control, making sure that people can be protected, making sure that trust by populations can be rebuilt, making sure that there is a fast and response and the response at scales, making sure that health systems become resilient to unexpected shock, but also at the same time trying to address those pre-existing weaknesses that existed into the system. In a way, there's a way of saying that you never should waste a crisis, and I think there is an opportunity probably to give some further impetus to reform in Mexico in order to make sure that the system is much better prepared for possible crises into the future.
How does Mexico compare with these countries in this context? Well, talking about the health system and the response to the pandemic.
So yeah, I mean, the health system of Mexico is, as I was mentioning, was lagging behind in a number of indicators from the OECD average. If we look at life expectancy, for example, and here I'm talking to before the pandemic, this was below the OECD average, although I should also note that if we look at the trend over time, is one of the countries which has seen some of the most significant gains in life expectancy. But if we look at other indicators in terms of resources, for example, spending, it's well below the OECD average. The number of doctors and physicians, when we talk about them, it's about 30% less than the OECD average. The number of nurses is about half the OECD average. The number of hospital beds, so resources which are less, and the significant share of out-of-pocket spending, so spending directly by individuals out of their pocket, which is around 40% of health spending, much higher than the OECD average, which is 20%. I think there are some important risk factors in the health of the populations, which are important to address precisely because the resilience to a crisis is not just the resilience of health systems, but the resilience of the populations to a health shock. So issues like obesity, the prevalence of diabetes, which is one of the highest in the OECD countries. There are some issues with drinking of harmful drinking of alcohol, which is quite concentrated among certain population groups, and issues with the quality of healthcare, which can be addressed, like particularly the variations in quality of care that exist in different parts of the country. So I think there are a number of indicators that point to a need to invest more into health system, trying to really address the pre-existing problems, building an agenda which is much more on anticipations of health needs, much more into the prevention policies, but also in building a very strong primary care system that can minimize the need for people to go into hospitals, addressing some of the issues related to fragmentations of the system. So creating really the condition for the Mexican system to be better ready to face any type of crime.
Are there some improvements right now? Have you seen it? Have you seen them?
I think so. I mean, I did mention, for example, in terms of life expectancy, if we look during the last decades, Mexico has been one of the countries that has constantly really increased its life expectancy during the past decades, and one of the countries which has had the highest growth rates in life expectancy. So this reflects clearly a lot of efforts that have been done over the year to improve the health and the health systems of populations. There are some other indicators, for example, in terms of tobacco consumption, where Mexico is on a particularly low level compared to the OECD average. There's been definitely many years of trying to address those issues of fragmentations that unfortunately remain in the system, but I think there is definitely a realization that those need to be addressed to have a system which is much more uniformized across the country, and at the same time trying to address the health needs, particularly of the most vulnerable, the poorest part of the populations. So we have seen some changes, but it's a system which is complex. It's a large country, it's very diverse geographically in terms of the health needs of populations. And it's quite clear that it's something that requires continued attention and investment to generate some results that are durable results.
Finally, could you give us some recommendations?
Yeah, I think there, first of all, there needs to really keep on trying to address the governance aspects. So reducing the fragmentation in the system is something which is important to manage rapidly a crisis situation like a pandemic, but also it's also quite fundamental for addressing any pre-existing weaknesses. Giving also strong attention into what the science says when there is a health emergency, but really the governance aspects and addressing the fragmentations, the lack of coordination, that's something which is fundamental. And it's also fundamental to reduce the inequities across the systems that persist, whether they're geographical inequities or inequities across different population groups. There are issues also of continuing on improving the quality of the services on the health system. There are deficiencies in monitoring of the quality, in the type of data indicators of quality, but also in the incentives for the system to function more coherently towards improvement of quality. So the safety and the effectiveness of the services is something which is important, because one issue is to say there is universal health coverage for the entire population and trying to achieve that. Another issue is to ensure that the services are of the highest quality and effectiveness and safety for all the populations. There is, and this is something that COVID-19 clearly put a spotlight on, a need for investing in the prevention, in those underlying improvements into the conditions of populations, also improving in the first level of care, so the primary care, so that people can be attended as soon as possible without any deteriorations in their care needs in the moments in which some issues arise, and they can be taken care of upfront immediately when their needs arise. And there is obviously an overarching issues of thinking about how do we finance all of this, and so how do we improve, also continuously improve the efficiency of the health system in context in which resources are clearly scarce in the Mexico health system. There is a need to really thinking how do we get the best outcomes, the best value for money from the resources which are invested. And all of this probably requires, it's a complex agenda, which requires strong governance, but also strong technical expertise. So keeping on building expertise in terms of human resources, both the health human resources, but also the human resources of all those that make the system function and that manage the system seems to be a fundamental element as well.